Let's talk about the renal system. And the renal system is a system that aims at controlling our blood plasma, filtering our blood plasma of things that are not needed anymore, waste products, things that could become toxic to our body, but also maintaining entities within the blood plasma or retaining them within the body so they're not eliminated. So I realize what I just said is somewhat complex, and I'm hopefully that there will be more clarity to it as we proceed through this lecture on introduction to the renal system. The renal system is the same thing as the urinary system. And truth be known, it can be quite complex to really put all this together and comprehend it. So we'll try to parse it down into smaller parts and simplify it if possible. One thing I will say, and I've said this repeatedly throughout different body systems that I've spoken of, is that it is really difficult to use the reductionist methodology to describe any of the body systems. And what I mean by that is to talk about them in a vacuum independent of each other. That is to say, talk about the respiratory system independent of the cardiovascular system because they are intertwined with each other. And the renal system or urinary system is intertwined with the cardiovascular system in as much as the respiratory system is. So we'll talk about that. What we see in this picture right here in teal is part of the functional unit of the kidney known as the nephron. Specifically, this region right here is known as Bowman's capsule, and I will outline this in a subsequent image. And this right here would be the proximal convoluted tubule. The pink structure right here is a capillary known as the glomerulus. The renal system arguably has the most challenging words within human anatomy to actually pronounce. So bear with me with a lot of these terms. So this pink structure is the glomerulus. The teal structure right here is Bowman's capsule. There's an intervening basement membrane between them. Don't worry about that membrane at this point. The combination of the glomerulus and Bowman's capsule is known as the renal corpuscle. So the renal corpuscle incorporates both Bowman's capsule and that capillary bed, which is known as the glomerulus. The glomerulus is not part of the nephron, but the glomerulus and Bowman's capsule, or the glomerulus and the nephron, would be meaningless without each other. So they work together. Providing blood to the glomerulus is the afferent arteriole. Taking blood away from the glomerulus is the efferent arteriole. And we're going to outline these all as we move forward. This is what's known as a portal system because we have an arteriole providing blood to the capillary bed, otherwise known as the glomerulus. And we also have an arteriole taking blood away from the glomerulus. And that efferent arteriole will give rise to a structure known as the peritubular capillary. Right here, we're just looking at the macroscopic structures of the renal system. That is to say, the ones we can see with the naked eye. We have a right and a left kidney. This left kidney has been sliced through via the frontal plane or coronal section. So we are looking at the internal aspect of that left kidney, and we'll talk about the different regions within the kidney subsequently. Right here is the urinary bladder. So urine is produced within the kidneys. And urine is produced via a number of processes that are carried out by the functional unit of the kidneys that we talked about, which are known as the nephrons. There are about 1 million microscopic nephrons per kidney. So 1 million nephrons in the left kidney, 1 million nephrons in the right kidney. They will produce urine, which will then be stored in the urinary bladder until time of elimination arises. Urine proceeds from the kidneys to the urinary bladder via these tubes known as ureters. So in this image, we see a right kidney, a left kidney, a right ureter, and a left ureter. The urinary bladder, which once again stores that urine, and then urine exits the urinary bladder via another smaller tube known as the urethra. Also in this image right here, we see the abdominal aorta and the inferior vena cava. The abdominal aorta is going to provide oxygen-rich blood to the kidneys via the left and right renal arteries. And then oxygen-poor blood is going to leave the kidneys via the right and left renal veins, moving into the inferior vena cava en route to the heart. So let's talk about some functions of the renal system. Down here on the lower right, I have a very basic depiction of a kidney. Sitting directly on top of each kidney is an adrenal gland, otherwise known as a suprarenal gland, that has nothing to do with the renal system. It's just where this adrenal gland is located. But as far as functions of the renal system, and I'm going to work backwards on this image right here, it is involved in gluconeogenesis. And gluconeogenesis is the process of making glucose out of non-carbohydrate precursors. So in this case with the kidney can take amino acids, which are the building blocks of proteins, and convert those amino acids into glucose in times of need. If we are really desperate for glucose in the body, we're not taking in any glucose, the kidneys can produce glucose via proteins or via amino acids through the process of gluconeogenesis. This is not an ideal scenario because in a perfect world, those amino acids would be used to produce more proteins for the body. The kidneys also help produce vitamin D. They are actually the end step in producing vitamin D. That is initiated via the sunlight and the skin. So the initiation of vitamin D synthesis is initiated in the skin with the help of UV rays. But that process is completed in the kidneys. Vitamin D is necessary to moderate calcium absorption in the intestines. There's also endocrine functions to the kidneys. So the kidneys secrete EPO, which we talked about when we were referring to the blood. EPO stands for erythropoietin, which initiates the process of erythropoiesis, or synthesis of more red blood cells. And the kidneys may seem like a random place to be doing this when we're talking about blood and red blood cells, but it is a prime location because the blood travels through the kidneys and through the glomeruli, the capillary bed that we looked at previously, many times throughout the course of a day. So the kidneys are actually a prime location to monitor the levels of red blood cells in the blood, the oxygen carrying capacity in the blood. And if those aren't up to par, then the kidneys will release EPO to stimulate the process of erythropoiesis. The kidneys also secrete renin into the blood, which helps control blood pressure. And we'll talk about that more as we move forward. So the last function I have up here, or role of the renal system, is the filtration of blood. And a number of books are going to suggest it's filtering blood to get rid of waste, which it certainly is. So it's getting rid of urea, uric acid, and creatinine. Urea is a result of protein metabolism, or the breakdown of proteins and amino acids in the body. Uric acid is the result of the breakdown of nucleic acids in the body. Excess amounts of urea can be toxic to the body. One example is it can increase the rates of atherosclerosis in our blood vessels. Excess uric acid could lead to gout or kidney stones, among other things. And creatinine, as well as urea and uric acid, if there are elevated levels of creatinine, then that is suggesting that the clearance of any of these waste products or any other entities within the blood plasma are not getting filtered as readily as they should, suggesting there may be some sort of renal insufficiency. Part of the filtering process is maintaining blood volume and blood osmolarity. And to me, those are almost saying the exact same thing. And without getting into too much physiology about it, the osmolarity of blood is a huge indicator of blood volume. That is to say, The higher solute concentration within our blood, the more retention of water within our blood. The more retention of water, then we're going to have a higher blood volume. And a higher blood volume is going to increase blood pressure. So certainly that's going to be a good thing depending on how much it's increasing the blood pressure. Is it increasing it to normal levels, or is it being increased above adequate levels or above acceptable levels? So the blood filters waste products like I suggested. It filters ions, sodium, potassium, calcium. Another very important ion that it filters is the hydrogen ion, the proton, the hydrogen proton, otherwise known as pH. pH is the level or the concentration of the hydrogen ion within the body, and in this case, within the blood plasma. And that needs to be very tightly regulated at all times. The nephrons within the kidneys filter glucose and any of the other nutrients floating through the blood. It helps eliminate hormones from our blood. So hormones are signaling molecules floating through the bloodstream that we only want in our bloodstream for a very limited amount of time. And if hormones are not eliminated, their action is going to probably be sustained longer than we need it to. So we're going to talk more about this. But as far as filtering, everything from the blood plasma gets filtered, with the exception of plasma proteins and any blood cells, the white blood cells, red blood cells, or platelets. Okay, so in this image, once again, I just want to reiterate what gets filtered. Now, I have the word filtrate here, and that is to suggest that blood plasma, once it moves from the glomerulus, once again, the glomerulus is that capillary bed within the renal corpuscle. The renal corpuscle is the glomerulus combined with Bowman's capsule. When blood plasma moves from the glomerulus into Bowman's capsule or into the nephron, which is the same thing, we now call it filtrate. We no longer call it blood plasma. So what gets filtered? The easy answer is everything but the formed elements, which are white blood cells, red blood cells, and platelets, and plasma proteins. Plasma proteins are the only component of the blood plasma that is not getting filtered. And when I say the only component of the blood plasma, please think back of that centrifuge tube that has been spun and how we break down the composition of blood from the hematocrit, the buffy coats, and the blood plasma up at the top. So the blood plasma is the only thing that's getting filtered, and everything within that blood plasma is getting filtered with the exception of plasma proteins, and they don't get filtered because they are either too large to move through the filtration membrane, or their negative charge tends to be repelled by a negative charge within the filtration membrane. And I'll have a video specific to that filtration membrane. But the reason we do not want plasma proteins to be filtered, we need to maintain the plasma proteins within the blood to maintain our blood volume. So the blood volume is huge. The plasma proteins are very significant in maintaining blood volume, and maintenance of blood volume is critically important for maintaining adequate blood pressure. And just a side note, I want to say, within anatomy, I talk about the relationship between volume and pressure. And that volume is almost always, that is to say, within this anatomy course, talking about the volume of a chamber, whether it's the left ventricle in the heart or even the blood vessels as a chamber. But I have always suggested that that's not the only volume we're concerned about. We are also concerned about the volume of the fluid or the blood plasma. And it's those plasma proteins that help maintain the volume of the blood plasma by drawing fluid into the blood due to the colloid osmotic pressure. For anatomy, don't worry about the colloid osmotic pressure for now, but I just want to highlight that plasma proteins are not getting filtered because we need them in the blood to help maintain blood pressure. Okay, so what I want to talk about now is the nephron. And the nephron is that functional unit of the kidneys that I talked about. There's roughly 1 million nephrons per kidney. So if there's 2 kidneys, that means there's about 2 million microscopic nephrons in our renal system. And what we see in tan right here is a nephron. In addition, we see some blood vessels related to the nephron. And I'm not going to use this image because this image is really just too hard to make out and describe different parts of the nephron. And actually, this is a pretty easy one to look at. Sometimes they are a lot more convoluted, if you will. So we're going to look at a more simplistic depiction of a nephron. Okay, so here we are. In pink, we have the glomerulus right here. Bringing blood into the glomerulus is the afferent arteriole, pronounced afferent, but this right here is the efferent arteriole. So I will very clearly distinguish the pronunciation, whether or not that pronunciation is correct, to clearly distinguish between which blood vessel I'm talking about. The afferent arteriole is bringing blood into the glomerulus. And to be clear, that's ultimately coming from the aorta. In a previous image, we saw the renal arteries bringing blood to the kidneys. And ultimately, that's going to end up in this afferent arteriole bringing blood to the glomerulus. Once that blood is in the glomerulus, filtration can happen. And to be clear, filtration is the action or movement of blood plasma from the glomerulus into this, which is Bowman's capsule. And once again, when I say filtration of blood plasma, that's everything but the plasma proteins and the formed elements. Things that are not getting filtered are exiting the glomerulus via this structure right here, which is the efferent arteriole. And then the efferent arteriole is going to give rise to another blood vessel known as a capillary, specifically the peritubular capillary. So back to the nephron. This is Bowman's capsule. And this whole structure is a tube, somewhat like a blood vessel. So oftentimes you're going to hear it referred to as a tube or the tubule cells, which line the nephron, and we'll talk about those at some point. Leaving Bowman's capsule is a portion of the nephron right here, known as the proximal convoluted tubule. After the proximal convoluted tubule, we see a portion of the nephron right here, known as the loop of Henle. And then after the loop of Henle, we have the distal convoluted tubule. It's called distal because it's furthest away from Bowman's capsule or furthest away from the renal corpuscle. And then the distal convoluted tubule drops into a structure known as the collecting duct. Now, if I'm going to say very strictly what components make up the nephron, I would say Bowman's capsule, proximal convoluted tubule, loop of Henle, and the distal convoluted tubule. I wouldn't include the collecting duct as part of one nephron. The collecting duct is shared by multiple nephrons. That is to say, there are going to be multiple distal convoluted tubules dropping their filtrate directly into the collecting duct. And to be clear, once again, with that term filtrate, once substances leave the bloodstream via the glomerulus right here and move into Bowman's capsule or move into the nephron, they are now known as filtrate. I should say the substance is now known as filtrate. And there's one thing I want to highlight, which I have yet to do. The body filters 180 liters of blood plasma every single day. And that number should sound crazy to you because we only have roughly 3 liters of blood plasma within our body, within our bloodstream, making up the blood. 3 liters of blood plasma, but our body, our nephrons, filter 180 liters per day. And that means that blood is coming through the glomeruli, all the 2 million glomeruli throughout the 2 kidneys and the 2 million nephrons 60 times per day. That is to say, we have 3 liters of blood plasma that gets filtered 60 times per day, that's 180 liters of filtrate produced every single day. And to be clear, we only produce about a liter to a liter and a half of urine on a daily basis, which means the great majority of substances that get filtered into the nephron get reabsorbed or brought back into the bloodstream, specifically into the peritubular capillary. And we're going to highlight this in the next image. Another thing I want to point out is when I say substances or the blood plasma gets filtered from the glomerulus into Bowman's capsule, it's not everything in the blood plasma in one fell swoop. If it were, we would lose blood volume immediately. We'd have inadequate blood pressure and everything would go downhill very quickly. So I'm not suggesting 100% of the water in the blood plasma actually gets filtered. Some of it will exit the glomerulus into the efferent arterial peritubular capillary and move back into the general circulation. Same thing with the glucose, same thing with amino acids, same thing with waste products. Hopefully more waste gets filtered than not. But to be clear, not everything gets filtered at any one given time. Okay, so here is a better look at the function of the nephron. Once again, the nephron in this image is teal. In pink, we have the afferent arterial giving rise to the glomerulus, giving rise to the efferent arterial. And then the blue at the top is the peritubular capillary. Filtration happens only at one location, and that is in the renal corpuscle. It is the interface between the glomerulus and Bowman's capsule. Once again, 180 liters of blood plasma get filtered every single day, creating filtrate. And that's what we see with these yellow dots right here. And like I suggested, 99% of filtrate gets reabsorbed back into our bloodstream. And the great majority of that reabsorption happens in the proximal convoluted tubule. I should say roughly 75% of it has already occurred by the time the filtrate makes it to the end of the proximal convoluted tubule. Reabsorption happens throughout the length of the nephron, but it mainly happens at the proximal convoluted tubule. And to be clear, filtration is the movement of filtrate from the nephron back into the peritubular capillary, back into the bloodstream. Sometimes there is fine tuning that needs to happen with the filtrate. That is to say, there's still some things within the blood that need to get into that filtrate. And there is a mechanism that allows for substances to move from the peritubular capillary into the distal convoluted tubule. And that is what's known as secretion. Secretion is the movement of substances within the blood plasma into the nephron. These are substances that may not have gotten filtered previously, but we would love to get rid of them, put them into the nephron so they end up in the collecting duct to produce urine. So to be clear, filtration and reabsorption are moving the same direction. That is to say, they're moving from the bloodstream into the nephron, but they're happening at two different localities. Reabsorption is moving the other direction, from the nephron back into the bloodstream, specifically into the peritubular capillary. And that is where we get this equation, E equals F minus R plus S. E refers to excretion. Excretion is urine. Once filtrate leaves the collecting duct that we see over here on the right, it becomes urine. And urine is produced, or excretion occurs as a result of whatever is filtrated minus whatever is reabsorbed plus whatever is secreted. We could write it out F plus S minus R. Whatever is filtered, whatever is secreted is ending up in the urine with the exception of whatever is reabsorbed. And to be clear, 99% of that daily filtrate ends up getting reabsorbed back into the body. I realize I haven't talked about the functioning of the loop of Henle. It's mildly complex at this point, but we'll touch on it a bit on a later video. Okay, so let's take a closer look at the kidney here. The kidney, the outermost part of the kidney, is the fibrous capsule of the kidney. Outside of that is going to be some fat protecting the kidney, which we don't see in this image right here. The light colored region right here is the cortex. Keep in mind, a lot of solid organs in the body are described as having a superficial layer known as a cortex and an interior layer or deeper layer known as the medulla. That's certainly the case with the brain, and that's also how we describe the kidney. So this lighter region right here is the renal cortex. And that is where the great majority of nephrons are residing, almost exclusively in the cortex. Some of portions of those kidneys dip into the renal medulla. And the renal medulla is everything from this teal colored structures down into this purple or pink structure right here that make up the renal medulla. So we have the renal cortex and renal medulla. And the renal cortex, the tissue of the renal cortex at least, dips in between these different pyramids. So these individually are known as the renal pyramids. And diving into these renal pyramids are going to be the collecting ducts of the nephrons, or shared by multiple nephrons. Each renal pyramid has a point which is known as an apex. More often than not, it's referred to as a papilla, or papillae is plural. This is actually the base of the renal pyramids up here. So we have a base and a papilla, or a base and an apex. Collectively speaking, the dipping in here of the cortex plus the renal pyramid makes up what is referred to as a lobe. And then the space inside of the medulla, without this pink structure right here, would be known as the renal sinus. But the renal sinus is occupied by the renal pelvis and the renal calyces. Right here is the ureter. So if we look back at that original image of a kidney, as such, we can see the ureter leaving the kidney right here. And the expanded superior and lateral portion of the ureter as it's exiting the kidney is known as the renal pelvis. So this region right here is the renal pelvis, giving rise to the ureter. And then we have the calyces, singular is calyx. The minor calyces are collecting urine from the collecting ducts at the papillae, or at the apex of the renal pyramids. So these are all minor calyces. The minor calyces are then going to drop urine or deliver urine to the major calyces. There's 2 or 3 major calyces within this area of the renal sinus. I don't have those depicted in this image, but just please understand that the minor calyces are receiving the urine from all the collecting ducts interspersed within the renal pyramids, and from the minor calyces they drop into the major calyces, which should be roughly in this region of the renal sinus, and then directly into the renal pelvis. The invagination, or dipping in here of the kidneys, is known as the hilum, very similar to what we saw in the lungs, where vessels, ureters, and nerves gain access to the kidneys. And one thing I have not mentioned yet is, where do we find the kidneys? The kidneys are found in the retroperitoneal space. They are sitting behind the parietal peritoneum of the abdominal cavity. And this tends to be a point of contention for a lot of students, or confusion, I should say, because when it is suggested that kidneys are in the retroperitoneal cavity, most individuals think that the kidneys are not within the abdominal cavity. They certainly are in the abdominal cavity, but they sit behind the serous membranes of the abdominal cavity. As a result, we refer to them being as retroperitoneal. And to be very clear on the body cavities, we have a ventral body cavity and a dorsal body cavity. Broadly speaking, the dorsal body cavity only contains the cranial cavity and the vertebral canal. And to be clear, the kidneys do not reside within the vertebral canal, which means they need to be in the ventral body cavity. And below the diaphragm, the ventral body cavity is either the stomach or the pelvic cavity, otherwise known as the abdominal pelvic cavity. So I want to be clear, the kidneys reside within the abdominal cavity, but in the retroperitoneal space of the abdominal cavity. Okay, just to be clear, we have the abdominal aorta right here. One of the first branches off the ventral surface of the abdominal aorta is the celiac trunk, which we talked about when we looked at circulation, bringing blood to the liver, the spleen, stomach, but also coming off of the aorta. Now, to be clear, it's not off the ventral surface of the aorta. It's off the lateral surface of the aorta, are the two renal arteries, right and left, providing blood to the right kidney and the left kidney. So we're going to take a closer up look at the circulation heading to the kidneys and then leaving the kidneys. Okay, so this is the same image we just looked about when we were talking about the anatomy of the internal structures of the kidney. Here I'm showing in green a nephron. So here's Bowman's capsule, proximal convoluted tubule, loop of Henle, distal convoluted tubule, and here's a collecting duct dropping down into the renal pyramid, through the renal papilla, into the minor calyx, into a major calyx, renal pelvis, and then the ureter. But we need to talk about the supply of blood to the nephrons. So right here is a renal artery, which gives rise to segmental arteries. 1, 2, 3 segmental arteries. For now, please disregard any of the blue, which is the venous circulation. Let's just focus on the arterial circulation. Renal artery, segmental arteries. Don't worry about the number if there's 2 or 3 or 4 segmental arteries. Moving in between the lobes of the kidney are the lobar arteries. And then arcing around the top of the renal pyramids on each of these are the arcuate arteries. So we have the renal artery, segmental artery, lobar arteries, arcuate artery, and coming off the arcuate arteries, we have the cortical radiate arteries. These are arteries that are radiating or emanating out towards the cortex. And we see that all along here. The cortical radiate arteries I'm showing here, I'm only showing one nephron, but please keep in mind there's 1 million nephrons per kidney. So in this kidney, there should be 1 million nephrons. Coming off the cortical radiate artery is the afferent arteriole, providing blood to the glomerulus. What doesn't get filtered exits the glomerulus via the efferent arteriole, giving rise to the peritubular capillary right here. The peritubular capillary is then going to return blood to the cortical radiate vein. So now we're looking at the blue. Cortical radiate vein, giving rise to an arcuate vein, interlobar vein, segmental veins, and then the renal vein, which brings blood to the inferior vena cava en route back to the heart. That is your intro to the renal system. Trust me, I know this is challenging. It's a lot of information, a lot of challenging terms to not only remember how to spell, but know how to pronounce. Easy for me to say. So, more on this to come.